Hi, I'm Joe Feeks, editor of Pig Health Today, and with me again is Dr. Joe Connor from the Carthage Veterinary Service. Thanks again, Joe.
Thanks, Joe.
I want to talk with you about Streptococcus suis. This is an old bacterial disease, but I've heard anecdotal reports, at least, that we're seeing more strep in swine herds than we did 5 years ago. Or another vet said, I don't know if I'm seeing more, but it's certainly becoming more complex. What have you been seeing?
Well, it's an interesting comment, Joe, you say, because I remember having these discussions more than 30 years ago about the concern of Streptococcus suis type 2 and what it might mean, because it's a zoonotic bacteria to our industry and what we had to do to mitigate some of the effects of that. And we have gone through a period of time where the occurrence of that or the virulence of that bacteria seemingly was lower grade than what it was maybe even 30 years ago. Then in the past 5 years, I would agree that we have seen the incidence of it increase, and in some cases the severity of it increased tremendously.
And why do you think that's happening?
I think it might be a combination of things. We have gone to a reduction of antibiotics. We have changed our population sizes in some cases with respect to more pigs on wean to finish barns. The virulence of the particular strain of bacteria has probably changed, and our ability to try to detect differences in the strains has also improved, giving us a little bit better understanding of the bacteria that we were trying to recover, and is it directly related to the outcome of those pigs.
And when you talk about the reductions in antibiotics, I think specifically you're referencing the medicated feed additives?
I'd say both aspects, Joe, because we clearly have reduced the medicated feeds, or medicated antibiotics that we've used, but we've also tried to reduce our treatments. And we've also had a segment of the production that has entered into never using antibiotics from birth to market. What we do see from looking at our production data would be that even when mortality is well within targets, and so let's use 3% wean to finish mortality, that our caregivers, if they're doing good recording, will still record about 50% of those losses due to encephalitis or downed pigs, that they would correlate to Streptococcus suis. Now, we know when we look at some of those that it's not a one-to-one correlation, but it is an indication that even in what we would consider to be, quote, high health flow, minimal mortality pigs, that we do see commonly Streptococcus suis as a trigger to that mortality.
And I wanted to ask you about that because I've heard it described as a disease of high health pigs. Why is that?
Well, I think because as we eliminate other viruses and certain other bacteria, then it gets emphasized as being a key component of the residual mortality that is here today. If we go back, and I'd say the same thing exists today, Joe, that we still don't have an understanding of what the virulence factors are. We know that the bacteria is commonly established in the tonsil of the sow, so it moves from sow to pig, and then from pig to pig as we commingle those pigs post-weaning, even within the same flow of pigs. The second thing would be that we still don't have the technology today to recover that particular bacterial isolate and be fully confident that it is the one that is only involved in the mortality and morbidity. What producers and veterinarians commonly find is that there's often 3 to 4 what we would consider to be different strains involved in the complex. And so over time, the reason it's become more important, we have understood that we've got to be persistent in identifying those multiple isolates that do contribute in order to get better control of the mortality and morbidity.
So when we're looking at strep infections, I mean, what's the battle plan? Is it prevention, control, treatment? What do you recommend?
Our focus today needs to be on first control and then on prevention. In the short individual cases, it has to be focused on treatment. We know, again, from our production records that early detection and treatment results in somewhere between a 50 and a 75% response or recovery rate. If it's not early detection and early treatment, then the recovery rate is well lower than 50%. So then we need to move into control, and we would all take a look at the normal items that might, or stresses that might influence the strep. So that would be the sanitation, it would be the temperature, humidity within particularly the first 30 days post-weaning. Mm-hmm. Then if the mortality and morbidity is at a certain point, we need to consider prevention. And prevention really goes back to, can I recover the individual strep that is triggering the clinical expression, and then either vaccinate the sows pre-farrowing to protect those pigs during the suckling phase, or to vaccinate the piglets during the suckling phase to protect them during the early nursery phase.
What do caregivers need to understand about strep?
We try to emphasize with the caregivers, Joe, is that early identification is really the driver of their successful response. So to do that, it is walking the pens very cautiously each day and looking for those early signs. And the early signs may be just as simple as when a pig gets up, you can see that it takes an awkward step. Mm-hmm. Maybe the step 2 and 3 look normal, so that's why critical observation is very important. They may also notice some nystagmus or moving of the eye if they can get in a position where they can observe those pigs. We emphasize that, and then the second thing we emphasize is that the other stressors have to be managed quite well. So pay attention to being certain they are, the environment is warm, the environment or pen is dry, the humidity is within manageable levels, and that they have good access to water and to feed.
But if you're walking the pens and practicing individual pig care, you might use an injectable antibiotic if you see something going on within that particular pig. But how do you know it's strep? Because not every antibiotic is going to get that bug.
The other tools we would use, one is we can take rectal temperatures. Normally these pigs will be quite elevated at 105, 106. We would recover tissue samples from them to validate, and generally we're going to recover that bacteria from either the brain or the lung, and then we would have a sensitivity to which we would use antibiotics. And you're exactly right, if the prevalence is quite low and we have early identification of that, we would just do individual piglet treatments. If it becomes a certain threshold, or if it is reoccurring at a certain time with each group of pigs, it's very common for us to administer a water-soluble antibiotic as well as a feed antibiotic for a short period of time to which that bacteria is sensitive to. Then we would move into prevention through farm-specific vaccines.
And these would be the autogenous vaccines.
That's correct.
And is that the only option right now for vaccination?
That is the only option today. So we recover the bacteria. There's virulence factors that we could look at, even though, as I mentioned, we're not always sure we've got great correlation between those virulence factors and the clinical expression, but we use that information to identify that strain and then to have a vaccine manufactured.
Does strep always present itself as a neurological problem, like it's associated with meningitis, for example?
There are other clinical expressions that you sometimes identify. So one is swollen joints or a lameness that is not yet moved itself to the brain, so no encephalitic type signs, but only a single leg lameness or a single leg joint swelling. And you can also occasionally recover the organism itself from the sow herd and sow population.
So what recommendations then, in summary, do you have for producers who might think that they have this, this bug circulating in their herd?
Yeah, I think the important thing to recognize is that it is common, and we can recover that bacteria routinely from the sow population itself. And today we don't have the technology to eliminate that bacteria. So we then focus on the preventive steps, which would include sanitation, very intensive navel cord treatments as example, good environments within both the farrowing house and particularly the early post-weaning phase. Secondly would be to look at identification of individual pigs early in the course of the disease because they will respond much more appropriately to treatments. Third would then be, if it's repeatable, look at either feed-grade antibiotics or water-soluble antibiotics. And then lastly, move toward preventive vaccines.
Well, good advice as always, and we'll have to keep an eye on this bug.
Thanks, Joe.
We've been talking to Dr. Joe Connor. He is president of the Carthage Veterinary Service in Carthage, Illinois. Thanks again, Joe.